So are there any alternatives that would provide similar relief that someone could use or could be prescribed versus an opioid?
I think there's a lot of things that people can do to prevent using opioids. One of the first things to do is remember that after surgery, after some kind of acute injury, as Dr. Holder said, you're not going to be pain-free, and we're going to have to accept some level of pain. Certainly not being miserable, but being uncomfortable. And that's one of the things that we need to think about. We want to look at the fact that we want to use non-medicine techniques first, and there's a number of things. As TJ mentioned, physical therapy is one, movement is one. You know, I'm an orthopedic nurse. When we had people that had orthopedic procedures, we immediately get them up moving, and we would say, the more you move, the better you feel, and that's certainly true. I know today we had lots of men and women running long distances, and I guarantee you this afternoon they're stiff and sore, and what they're doing to cope with that is movement, and that will make a big difference. And that's why physical therapy is so very helpful for that kind of stretching. But there's also things like ice, there's heat, yoga. And you know, I don't know if you know, but you can get a yoga app on your smartphone and do yoga whenever you want to. You can also try meditation, which is also an app on your phone if you want to choose that. So there's a lot of things that get you up to medicine. And then when you're looking at medicines,
injections?
That's next. The next thing that we certainly want to look at is non-opioid medicines like Tylenol, like ibuprofen, like Motrin, like Aleve. Those are the kind of things that we would want to do before we look at opioids. And I know Dr. Savu wants to talk to us about maybe injections being something that would be totally appropriate too.
I know a lot of people have, one of their pet peeves is injections. They're needles and nobody likes needles. But let me try to put this in perspective. Until recently, we thought opioids, and that's one of my pet peeves. Until recently, we thought opioids, well, anti-inflammatories should be tried first, Tylenol should be tried next, or the other way around, and then opioids should be the next line of attack. Let me give you some examples. Surgery. Let's say you have a herniated disc. You have surgery. Nobody dies from back surgery. The same disc can be treated with a series of injections that will heal, that will help the body heal itself. Nobody dies from back injections anymore. I mean, those are legends that don't survive the reality. Physical therapy, as you said, nobody dies in physical therapy. Pain medication. Let's take that as a first line of attack. 115 Americans die every day from use the endorsed prescribed use of opioids. If I would do an injection that would kill one person a year, I would be put in jail, justifiably so. Mm-hmm. So I want to clarify one thing. Opioids are the last resort, not surgery, not injections. If nothing else works, I can tell a patient, we're taking a humongous risk of you actually dying when we're going to put you on a medication that you're going to have to take for the rest of your life, and that's an opioid. It doesn't work that well in the long run, because as you keep taking it, our bodies get used to it, and we develop what is called tolerance. You need to take higher and higher doses to obtain the same effect. It's, in a way, it's an immunity that we develop to those drugs, and that's not something that I can do better than you. We're all the same animal. We respond in the same biochemical manner. And if I take long enough a certain dose of medication that is helpful right now, I guarantee to you within 3 months that's not going to help. So what do? I'm going to my doctor and I'm asking over a higher dose, because that's what's going to get me going. Mm-hmm. Where do we stop? It never stops, because there's no such ceiling effect where at some point you're going to reach that steady state where you take your pain medication, your pain is down to 0, 1, you live happily ever after. We started talking about the other side effects of taking the pain medication. Depression is going up 3-fold or 5-fold, depending on the study, in patients who take pain medication. Is it because they were depressed and now they're using pain medication to treat their depression, or is something that the opioid causes? Who knows? Who cares? erectile dysfunction, impotence, libido dysfunction. Everybody who's taking, every male within the nubile age group that takes pain medication for 3 years is guaranteed to have some form of erectile dysfunction. You take it for 5 years, your testosterone is in the bottom of bottom percentile. Those things don't come back. So those are risks that anybody who decides to take pain medication needs to be thoroughly educated about, because if you put it in that way, patients would do the right thing and say, well, maybe that's not for me. Maybe that's a very heavy price to pay for the immediate but short-term relief that I get for 2 or 3 hours. Injections help you for 3 or 4 months. And surgeries may help you for longer, may help you for another 6 to 12 months. All of those tools don't cure anything. Your body heals itself, your body cures itself. All I'm asking is for the patients to give me an opportunity to decrease the pain so their own mechanism can take over and heal. Our bodies are made to heal, or else would die within the first 24 hours of our lives. So all I'm trying to do is minimize pain and make it easier for you to do your physical therapy. You have depression. There is evidence, plenty of evidence, that physical exercise, yoga, heals depression as well, if not better, than antidepressants. But nobody gains from you doing your exercises. Nobody makes billions of dollars selling you yoga or physical exercise, whereas the big pharma can peddle it and make a ton of money. On a regular day, I see about 4 or 5 patients who are on triple or quadruple antidepressant medication who are in terrible shape mentally. What does that tell you? So there's a role for medication, for opioid medication, but that needs to be taken into account the following manner. It's just one other tool that makes it easier to do the right thing.